This is task 4, rapid sequence induction, and we are going to start by pre-oxygenating the patient for about 5 minutes. And I'm going to turn the camera off while we're doing that. So we have the induction agent drawn up. We have 3 mils of propofol. There are no air bubbles in it. I have already gotten those out. We are going to flush the patient's catheter, and you want to do that with heparinized saline at 5 units of heparin per mil of saline. Flush it with 2 mils. And we're going to now administer the propofol. And we will do about a quarter to a half of a dose and check to see where she's at. So she's still swallowing, so we are going to give her some ISO and try again in a minute. While we were giving her some ISO, I went and changed my shirt in case you're wondering why it's different. And she is now ready. Spot. Go back up. I know I will have to tie it in here in a second, but it'll just have to be. And I felt there was nothing there. I felt the air coming out of here. And I need to inflate the cuff. Tie it in now. And she's ready for her dental. This is task 6, and it is I'm going to go over the things that should be monitored during anesthesia. You want to measure the heart rate. You can use a stethoscope to make sure that the heart rate is good and normal. Usually the heart rate is between 60 and 150 beats per minute. It's higher on small dogs and cats, lower in large dogs. If the heart rate increases, it could be due to a lighter stage and plane of anesthesia. Usually, like stage 2, stage 3, plane 1. That's too light to do any treatment. If the heart rate is too low, it could be due to they're too deep of anesthesia, and such as stage 3, plane 4, and even into stage 4, which is very concerning. The heart rhythm should be pets should have a normal sinus rhythm during the procedure. Some do develop arrhythmias, sinus arrhythmias during anesthesia. It can be caused by the pre-medication. Arrhythmias can also be caused from the patient being hypoxic or hypercarbia, stuff like that. You should also check the patient's mucous membrane color, which is why I have Bugsy here. So you want to find out what is normal for your patient. Sometimes they have, if you look under here, you want their gums to be like a bubblegum pink. He has kind of, his are a little paler than normal, but that's, normal for him. They're not like super pink. If the dog does have pale mucous membranes, it could be due to poor tissue perfusion, anemia, blood loss, that sort of thing. You want to make sure. The other thing is they're not cyanotic, so they're not blue or purple, because that is indicative of super low oxygen, and that needs to be remedied ASAP. The capillary refill time is where you lift the patient's gum or lift the patient's lip, gently press on the gum, and watch it go to blanch to white. When you let off, it should come back within less than 2 seconds. If it is greater than 2 seconds, could be due to low blood pressure, blood loss, shock, that sort of thing, or the anesthetic depth is too deep as well. Pulse and blood pressure decreases, and during there will be a drop in pulse and blood pressure the deeper they are in the anesthesia. If it's too low, the hypertension can be caused by the pre-meds that were used, dehydration, heart disease, that sort of thing. So if it gets too low and they're in stage 3, plane 3, plane 4, we want to come and bring them back out a little bit, and hopefully we can get that, get that blood pressure elevated. Respiratory rate decreases with the depth as well. Normal is 8 to 20 breaths per minute. If there is an increase in the respiratory rate, it could be that they are coming from moderate to a light anesthetic depth. So if we're still during the procedure, you may want to take them down a little farther. If they get below 6 breaths per minute, that is very dangerous and needs to be reported to the VIC. Respiratory rhythm should be a steady inhale and exhale, longer on the exhale than on the inhale. Short, jerky breaths happen in stage 3, plane 4. Apnea happens in stage 4. So that's very, very concerning. Need to try to get them to wake up. Temperature normal is for an anesthetized patient is 97 degrees to 100 degrees. That needs to be checked every 15 to 20 minutes. Usually check it every 5 when we're checking everything else, just to keep it all on the same track. The greatest loss of temperature happens within the first 20 minutes. Hypothermia, if their temperature is too low, has a prolonged recovery period, and if it gets super low, you can have CNS depression as well. The other monitoring equipment that we have on our machine is a capnograph that measures the amount of carbon dioxide that the patient is breathing in and out. On an inspiration, you want it to read 0, expiration 40. A pulse ox is the other thing that's on there, and that is an estimate of the saturation of hemoglobin. During oxygen administration, you want it to stay above 95. During a procedure, when it starts getting low, that's very concerning. And if the patient is if it gets down to less than 85 for greater than 30 seconds, that is a severe medical emergency. So we have our monitoring form here, and this shows, I kind of have some highlighted on where it should be during most surgical procedures, where it's concerning, and where it is really bad. So I will show a close-up picture of that so you have a better idea of what's on there. Our forms only have respiratory rate, the pulse ox, so the temperature and the respiratory rate is the monitoring parameters that are on our forms. Alright, so now we're going to talk about to tell with the reflexes on depth of anesthesia. So we want to start with the ear flick reflex. So a lot of times you just kind of want to like mess with the hair in their ear. You can kind of flick the ear a little bit and see if it twitches. You will have that in light anesthetic depth, medium and deep. There will be no reflex when the ears are touched. The pedal or withdrawal reflex, if you pinch a toe, they will jerk their foot up. You can do that on a hind leg, usually front leg, either way, they will pull it up. That will be present in light anesthetic depth and absent in medium and deep anesthetic depth. Palpebral reflex is when you tap above or below their eye and they will blink. That is present in light anesthetic depth and decreased or possibly absent in medium and completely absent in deep anesthetic depth. The corneal reflex is the blink response, which I'm not going to make him do, or in the eyeball kind of goes into the orbit a little bit. How you test that is you stimulate the cornea by putting in a drop of artificial tears and see how that response is. It is present in light and medium anesthesia, absent in deep anesthesia. The swallow reflex will be when they're obviously whenever they can swallow, and that will be present in light anesthetic depth and absent in medium to deep. Then we have jaw tone. So whenever the patient is under, you can kind of gently pull down on the jaw. Obviously, you can't really do that so well with an awake patient. They will, if they are still too light, they will resist that pulling down. It is usually, the deeper they go, the easier it is to open. In deep anesthesia, it's totally flaccid where you can, move it without resistance. Their eye position is based on the orientation of their cornea. In light anesthesia, it is center. In medium anesthetic depth, it is ventromedial, so they kind of go down. And then in deep anesthesia, they are center again. Respiratory patterns is, they decrease, the respiratory rate decreases as the anesthetic depth increases. The respiratory rate increases when the anesthetic rate decreases. If their rhythm of respiration should be smooth and regular inhalation and exhalation. If they are too deep under in the anesthetic planes, in stages, then they can have jerky respiration, they can have apnea episodes. If they start gasping or having difficult or labored breathing, then that is something that needs to be addressed immediately. The physiological status and stages of anesthesia are related to each other by monitoring both of those. By monitoring the physiological stages, you can kind of tell where they are in the anesthetic depth and stage and plane. You want to keep the patient in the best possible stage of anesthesia for the procedure that they are performing. That keeps them safe and happy and are able to recuperate easiest. But all those stages need to be monitored, and all the physiological statuses need to be monitored as well for the safety of the pet. This is task 18, autoclaving a pack. First, here is the autoclave. It's a gravity steam autoclave. We will open the door. It has already been filled with the water where it needs to be. So we will place our pack inside. We'll close the door, which is not an easy task to do. Alright, and we will turn the knob to, we'll turn sterile, but first we will set the time to about 40 minutes. And put this to sterile, and the pressure, pressure's over here. Pressure will be somewhere between 20 and 30 psi. The temperature usually around 260, 270 mark. And once this has finished in about 40 minutes, then we will come back and open it. The autoclave has stopped running, so we are going to switch this over to vent. Let the steam out for a few minutes before we open the door. And so you don't have to sit here and watch this. I will turn the camera off for a minute. Okay, so it's done venting, steam's all out, so we are going to open the door. Crack the door, I guess, a little bit, and we'll finish letting the steam out for about 10 to 20 minutes, and then I will come back and pull the pack out. We can now take the pack out of the autoclave, and we are going to sit it over here on the table to dry. Sit those there to keep it from sliding off the table. And once the doctor opens the pack for the procedure, then I will show you the strip inside. This is the indicator strip from the pack that was wrapped. I could not take a video of the surgeon undoing the pack because it was in surgery and the video camera would not fit in there. But here is the indicator strip that came out of that pack.